And so I'm Dan Chenok. I'm the Executive Director of the Center for the Business of Government here. And we are a think tank of sorts inside IBM. We work with academic experts and nonprofit partners, including our partner that I'll talk about in a moment, the Center for Open Data Enterprise, to do research on issues of interest for government leaders, where government leaders tell us topics that they want to know more about. And then we work with partners who are experts who are not in IBM to write about sort of how can the government move forward in particular areas. And these can range from technology to data analytics to how to be a good leader. So there's a broad research agenda. All of our content is public domain at businessofgovernment.org. And again, we welcome all of you here. We are here today to talk about a series of reports that we did with the Center for Open Data Enterprise. And Joel Gurin is here, the president and CEO, and his team, who have been just great partners on this effort. Part of our research agenda involves research on how to drive greater equity across government programs, both in sort of within government and how it operates, and also how it serves citizens and works with small businesses, et cetera. And we were talking to Code and Joel and his team about using some of their expertise, leveraging some of their expertise in their connectivity with the data analytics world and some work that they had been doing previously in the space to try to find how can we sort of focus on particular sectors. And we chose 3 sectors to look at 3 different reports that hopefully you've got links for that we sent for, one around healthcare, one around housing, and one around workforce issues. And there are some other topics that Joel will talk about momentarily in terms of how sort of we took these reports and are moving forward, and you'll see some sort of interactive activity going forward. It's a great agenda this morning. We'll hear from a leader in the White House. We'll hear from a great panel, fantastic panel. Those of you that are in the room can ask questions by raising your hand. Those of you that are online, we have folks that are watching the chat, so feel free to use the chat function if you want, and we'll make sure that we have this be as interactive as possible. For those of you that might need a restroom during the meeting, it's right back out the way you came and to the left, and there'll be somebody to let you back in. And again, this is a conversation that we hope is an ongoing one, and we, in addition to the discussion we're having today, we look forward to your discussions going forward with us on these issues, because as Joel will talk about, we have more plans in the works on these topics. But first, it's my honor to introduce April Chen. April is with the White House Office of Science and Technology Policy. She is a Presidential Innovation Fellow. So she was a leader and successful in a private sector career and in civic technology. She has a deep background in data science. And April's here to tell us about the administration's work in this space. So April, thank you so much for coming.
This is a good place to stand. Okay, I just want to say thank you so much for having me here today. I want to start off by first expressing my gratitude to Code and the IBM Center for the Business of Government for hosting all of us. I'm April Chen. I'm a Presidential Innovation Fellow with the White House's Office of Science and Technology Policy, or OSTP for short. The goal of OSTP is to harness the power of science, technology, and innovation to achieve America's greatest aspirations and to tackle our biggest challenges. My background, as mentioned, is in data science and machine learning and artificial intelligence, primarily in private sector tech. But I've since left my career in private sector tech and have started a career in public service about 2 years ago at OSTP. And I am just thrilled to be here today to talk about how the White House and the federal government is using data to drive the Biden-Harris administration's equity commitments. On his first day in office, President Biden launched an ambitious whole-of-government effort by signing an executive order on advancing racial equity. Earlier this year, we built on this commitment by signing a second executive order on this critical issue. The combination of these executive orders acknowledge entrenched disparities in our laws, in our public policies, and in our public and private institutions. And then it also directs the federal government to remove systemic barriers that prevent equitable access to federal resources. I think we're all data people here, so we know that in order to be able to advance the administration's equity priorities, we need to be able to measure whether policies or programs are actually equitable, and then course correct if needed. And then for this reason, President Biden's first executive order directed the administration to gather the data necessary in order to inform these efforts. The vision was to make the collection and access to disaggregated data, and to do so while also robustly protecting privacy. We have identified shortcomings in the infrastructure for data collection, and we've set a strategy to improve equitable data practices across the federal government. In April of last year, we released recommendations from this work. A key recommendation is that the federal government needs to make disaggregated data the norm while protecting privacy. So what is disaggregated data? Disaggregated data is data about groups separated out by race, ethnicity, gender identity, sexual orientation, veteran status, geography, income level, disability status, and other factors. Collecting data in such a way allows for us to do rigorous assessments in order to identify disparities and also illuminate opportunities for targeted action to have an improved outcomes on historically underserved and overburdened communities. So what can we actually do with this data? Amongst other things, we can use this data to identify communities that face barriers to access federal resources. We can use this data to identify communities that are being left behind by workforce support programs, especially those communities that are facing economic downturns. We can also use it in order to identify communities that need resources for climate resilience and also affect services to address housing instability and homelessness. So last fall, the administration began to operationalize these recommendations. And I just want to talk about a couple of the milestones that we've had since then. OSTP is working right now to increase the capacity of all agencies to conduct rapid equity assessments in order to affect and inform their program design and service delivery. We've developed tools and resources to scale the impact of these equity assessments in order to inform these agency equity strategies. The administration is also coordinating right now across the entire interagency in order for us to all share knowledge and best practices on equitable data. Currently, there are more than 500 federal employees who are all participating in this community. And also just recognizing that there are still gaps in data disaggregation that impact specific communities. OSTP has also had dedicated efforts around addressing gaps in data on the delivery of services and funding to Puerto Rico and US territories, sexual orientation and gender identity data, disability data, data on rural and urban communities, and then data on criminal justice statistics. It has also directed all agencies and mandated them to create equity action plans and teams and ensure that they have the sufficient resources, including staffing and data collection and analytics capacity in order to measure and drive progress on equity priorities. So all federal agencies at the moment are participating in this process and making comprehensive changes across the federal government. I think so far I've talked a lot about what the federal government is doing to hold itself accountable. And while it is very important for the government to use data to hold itself accountable to our equity commitments, it's also equally important for the government to be transparent and make data open in a way that allows us to be held externally accountable as well. So in December of last year, President Biden released the 5th U.S. Open Government National Action Plan. This builds on the work and the directives of the Obama-Biden administration. What this is doing is this action plan makes a commitment to expand the federal government's production, dissemination, and use of equitable data. So specifically, what does this mean? It creates feedback mechanisms through which members of the public can request and access data to hold the government accountable, coordinates across federal agencies in order to share effective best practices and improving the feedback loops between public data users and federal data stewards, as well as improve public engagement. Transparency is so important, not just to hold the government accountable, but also to build public trust and confidence, both in the government and democratic institutions. So while the federal agency level work on equitable data is so vital to advancing equity through the federal government, it's also equally important for us to make segregated data publicly available, but also protecting privacy. Advancing equity is such an ambitious and big goal, and we need all your help in doing this. Open data enables you to truly and effectively partner with the federal government to achieve this goal. And with that, I'm so looking forward to hearing from this panel. Thank you.
Thank you, April, and thank you so much for that really great overview of what the administration is doing in this area. I have to say that when President Biden came into office and made equity a priority and made data for equity a priority, it really inspired us at Code to do a lot of the work that we've done since then. So I'm Joel Gurin. I'm the president and founder of Center for Open Data Enterprise. We go by Code. We launched in 2015. We're a nonprofit organization based here in Washington. Our mission is to maximize the value of open and shared data for the public good. So just a small, modest mission that we have. And to do that, we do a number of different things. We do research papers like this one that we've done with the IBM Center, all of which, of course, are available on our website, which is odenterprise.org. And I hope you'll check it out. We do a lot of convenings. We sort of specialize in doing open data roundtables where we bring together data users with data providers, often in partnership with the White House or with federal agencies. We've done about 30 of these in the US now and several internationally as well. And then we write up reports after those are done. And we also do online resources, one of which we're going to launch today and demonstrate for you in just a few minutes. But just to tell you a little bit about, we have really been running a program on open data for racial equity since 2020, with the real national attention focused on Black Lives Matter, as well as the work we saw with the Biden administration. We were hoping that we could really make a contribution in this area. And we began with a briefing paper on policing data, looking at ways that data could be improved in the interest of improving community policing, as we were learning about all the really difficult issues emerging there. And then began to think about how we might also expand to look at other areas where data could be used in the service of equity as well. The Open Data for Racial Equity program was launched by Temilola Afolabi, who you will see on screen in a minute, also by Paul Kuhn, who's here today, and Matt Rumsey, also here from Code, has been very involved in the program also. So over the last 3 years since we began, we've really looked at 5 major areas. We've looked at how open data can be used to improve policing at a community level, how it can be used to help improve health and healthcare services, how it can be used to improve environmental and climate justice, how we can look at data in the context of improving workforce opportunity and also improving fair housing. And the reports on healthcare, housing, and workforce opportunity are all ones that we've done with the IBM Center. So we're really tremendously appreciative. Dan and Ruth Gordon is here also, of the ability to work with IBM on this important program, and we do hope that there's more ahead. And we also, I should just say, there's going to be a lot of time for Q&A after the panel. We really welcome any thoughts or input that you have from us on where this work could go. So we are now ready for a terrific panel that I'm very, very eager to hear. And I'm going to begin by introducing today's moderator, Natalie Evans-Harris. Natalie is the founder and president of Harris Data Consulting. She is a mission-driven data scientist, strategist, and speaker with more than 20 years of experience leading initiatives, coalitions, and organizations to equitably leverage data to combat economic and social injustice. She has founded and led multiple organizations, including the Black Wealth Data Center and Bright Hive. She served in the Obama administration as a senior policy advisor to the U.S. Chief Technology Officer and in the Biden administration as a senior advisor to U.S. Secretary of Commerce Gina Raimondo. And I'm also proud to say she is a former board member of Code. So Natalie, so great to have you here. Welcome, and panelists, please come up as well.
Hi, everyone. Hope you guys can hear me. I don't yell, but if I need to, I will. I'm Natalie Evans-Harris. Whenever I hear my bio read, I always feel like, wow, that sounds like a lot of cool stuff. At the end of the day, I'm an ecosystem builder. What I love to see and what I strive for is that data be used for action. It's an actionable resource. So it was exciting for me when the Obama administration signed its first executive order, making data basically a strategic asset. And then to see under the Biden administration, the evolution of it move to being not just a strategic asset, but an actionable resource. So it's because of the work of the people in this room, people online, people who are committed to seeing data being more than just sitting in a database, sitting in a warehouse, and actually seeing it get into the hands of the people that can make changes at the community level. That's what excites me about data. And so I'm excited because what we're talking about today is just that. How do we turn data into an actionable resource? What have we seen? What can we learn? And where can we go moving forward? So I'm excited for this discussion. I am excited for the discussions that'll happen after this. And I will also point out that one of the bad habits I've developed over COVID was not memorizing what I'm going to say. So you will see me reading from a sheet of paper, but it is mainly because I don't know how to talk from things that aren't talking points anymore. So I'm excited today because we're going to have a conversation with these three amazing ladies who have been working in the data space, some longer than me, some who didn't even know they were data people until we started talking about data. And so before I tee up our very first question for this panel, I'd like to quickly go around and introduce you to each of these amazing panelists. First to my left is Dr. Jeanita Pritchett. She is the recently appointed Chief Scientific Diversity Officer within the National Institutes of Health at the National Center for Advancing Translational Sciences. In this role, she focuses on addressing systemic issues that have hindered diversity and inclusion in the translational science field. She previously served as the acting director of the National Institute of Standards and Technology's Diversity, Equity, and Inclusion Office, and was responsible for leading the development and implementation of the NIST Diversity, Equity, Inclusion, and Accessibility Strategic Plan. Please welcome Dr. Pritchett. And then on the far left, Dr. LaShawn McIver. She is a proven public health leader with 20 plus years of experience driving successful initiatives aimed at promoting health equity, improving health outcomes, increasing access to quality care, and promoting health system reform. In July, she joined America's Health Insurance Plans, or AHIP, as its new Chief Health Equity Officer and Senior Vice President, where she serves as a thought leader for AHIP's health equity strategies and programs. She also provides strategic leadership for an overall industry-wide health equity strategic roadmap for AHIP as a member-driven association. Dr. McIver is a former director of the Centers for Medicare and Medicaid Services, CMS, their Office of Minority Health. Please welcome Dr. McIver. And Kathy Pettit. She is a principal research associate in the Metropolitan Housing and Communities Policy Center at the Urban Institute, where her research focuses on neighborhood change and how communities use data for more effective and equitable decision-making. Ms. Pettit is a recognized expert on several small area, local, and national data sources, and on the use of neighborhood data in research, policymaking, and program development. She has conducted research on topics including neighborhood redevelopment, federally assisted housing, and local housing markets and conditions. Ms. Pettit also co-directs the National Neighborhood Indicators Partnership, a national network that supports local communities in their use of data to shape strategies and investments to ensure all neighborhoods are places where people can thrive. Please welcome Ms. Pettit. Are you doctor? No? Oh, that's your So it's wonderful to have you all here. I will say I am going to ask prepared questions, but this is absolutely a discussion. I may go off script. You all feel free to go off script as well. And I look forward to prepare your questions for the end of this panel. To kick off the day's discussions, I want to come back to the remarks we heard from White House Innovation Fellow April Chen and CODE's presentation of its Story Maps website. April made some really interesting points about the White House priorities in implementing the recommendations for the Open Data Working Group, including OSTP's capacity to conduct rapid equity assessments, and its focus on providing better data on delivery of federal funds and services to Puerto Rico and the U.S. territories. It's also great to hear about Biden's U.S. Open Government National Plan to create new mechanisms for data access. And she's right, they've been working hard from day one to work with the agencies on not just what data should be published, but how it can be published to be most effective for those that want to use it. Likewise, Temi was able to show us what can be done when more data is available to the public and can be mapped at the granular level of communities. It's exciting to see tools like the story maps. And if you haven't checked out Black Wealth Data Center, as the former executive director, I gotta plug it. It's amazing to see what the power of not just open data can do, the narratives and stories it can tell. But when we can disaggregate that data by race, all the things we can learn about what's happening in our communities, intended or unintended. So I encourage you to not just use the tools that are available to you, but also as an ecosystem builder, tell the people more. What questions do you need answered? What more do you want to learn? And how can this help you in using data as an actionable resource? So based on what we heard from April and saw in Temi's presentation, where have you seen this come up in your work? You want to start with this, Jeanita?
So first, thank you so much to the organizers for putting on today's event and for the invitation to participate on such an esteemed panel. I'm really excited to just talk to you all about the work that we've done in this space, both in my current role, which I just started 3 days ago, as well as my former role. So for those that are online, my name is Jeanita Pritchett. My pronouns are she, her, and for anyone that may need a visual description, I'm a Black woman sitting here in a cream blazer with a black shirt and black pants and curly hair on my head. But so when we think about what was presented through Temi's presentation in April, I mean, this really has been the crux of the work that we've done since day one of the administration. Whenever this first rolled out back in 2021 now. Oh my goodness, it's been that many years. I remember there being just a scramble for how do we approach this? What should we do? But I was so appreciative of the work that the White House, that OMB did to help really assist the government agencies to be able to fulfill this mission of providing data as a resource and really addressing and dismantling barriers and systemic issues that have prevented different communities from advancing. And so seeing this idea of these story maps, I was thrilled to look at that platform last night whenever I looked at it, and just thinking about how can we integrate this with other things that are available. In my new role within the NIH, we offer a number of different open data sources that are available to help really move the needle in biomedical research and to address different health disparities. And so from one of my questions that came up is how do we connect some of these data sets so that we can ensure that not only are we building on these maps and these community stories that we can see through the platform that's been created, but then connecting connected to specific diseases or connected to specific environmental factors that are impacting a number of different communities. One particular data source I would like to point out to you all that is really relevant to the healthcare story map that was presented not too long ago is through NCATS, the National Center for Advancing Translational Sciences, has the National COVID Cohort Collaborative, or N3C, and this is a nationwide electronic health record platform that really is revealing critical insights into long COVID, breakthrough infections, and understanding the risk associated with things like race, age, chronic conditions, and other treatments that are available. Through this particular platform, which again houses a series of data that is accessible, some is protected, some is open to the public, it was able to show things like how Paxlovid was able to cut down treatment or your likelihood of being in a hospital, but it also showed that Black and brown communities weren't able to access this particular intervention. And so now by having that data available, we can think about, okay, what awareness campaigns do we need to put in place to ensure we're reaching communities so they know how this can impact their health and well-being. And there's a number of different examples that I could present, but I definitely want to give my colleagues time to speak, but I'm just really thrilled to see that this has gained so much momentum and that we're continuing to push the needle forward.
And what I love about sorry, I'm gonna jump in. What I love about what you've just talked about is not just the power of leveraging open data and being able to visualize it, but its intersectionality with other data sets. So that's something we learned, right? The Social Vulnerability Index, if you haven't seen this thing from CDC, it's amazing. It's one of my favorites because it has this broad swath of information around natural hazards in our communities. Think about the water crisis in Jackson, Mississippi. If you can take what the Social Vulnerability Index tells you around which areas in the nation are more likely to suffer from floods, more likely to suffer from water crises, and then or hurricanes, you overlay that with, say, housing data that tells you where our Black and brown communities actually are, what you'll see is a lot of those communities are in those dangerous areas. To know that information ahead of time, what we've learned is that American Red Cross can do things like know where to target resources before the disaster happens. What we've learned is that policymakers can now know these areas are most at risk, and we can drive policy and we can direct programs to support those. That's what data as an actionable resource looks like, and that's what it looks like to turn our open data into these types of things.
I have 100 thoughts. You want to meet lunch after. I think just to start with just the appreciation of Biden, both the practical achievements, but also the power of being a champion and cheerleader for this work. So that ripples down to the local governments, to other nonprofits, and really gives an endorsement that we can, a good foundation. I'll plus one on the disaggregation of place and finely ingrained data in particular. I think you just mentioned sort of where you live affects your resources, your opportunities, and intersects with any given issue you can come up with. So not just knowing the race, but the place really matters for equity. I can't wait to spend more time with the story maps too. A couple of things. One, I do think a big barrier still is awareness of what data is out there. So there's amazing data sets. We can all name our favorite. I have one, the employment data set loads that shows commuting patterns and worker characteristics. That's very hard to use. But so I think these kinds of story maps just help to, and the SVI or other pieces about what's available is really helpful to help just spread the word. I think the other piece I really appreciate is attention to history. So data has been just used also to harm people and harm communities. And we really think about both individual harm, like a mortgage discrimination, but also community harm, like stigma, or blaming people for outcomes and their behaviors. So I think understanding the historical context of how data was used is really important, especially if you're going to be interacting with communities of color and low income that may have experienced these negative data pieces as we bring all of these positive benefits to folks. I think I'm lucky that with my network, I get a new example every day about exciting local work with data, but I also run a grant program called the Catalyst Grant Program, which I'll do an advertisement. We launched our RFP last Monday. It is for nonprofits that are seeking racial equity and reform in the criminal legal system. Small grants plus technical assistance that's wrapped around. And one of our past grantees, Spur in San Francisco, pulled both open data from California along with the American Community Survey to look at traffic stops. And I think that's one of the examples from Austin here and Urban Institute's work here, both not only the stops, but what were those outcomes of the stops. And they were able to disaggregate by race, ethnicity, and gender, which is also very unusual. So they, possibly not surprisingly, for one of the stats is that like 30% of Black people were stopped for an equipment reason, like a headlight or something like that, or a license plate, and only 12% of white people were stopped for that. And there's, like I said, they do it for Latinx groups and other people. So this data was open, but it is kind of it's just dead without any people to tell the story, to visualize it. And with their advocacy agenda and the right people at the table, they were able to convince San Francisco to stop pretext stops once they really revealed these disparities and publicized them widely, of course, and to minimize some of the enforcement of really minor traffic enforcement pieces. But more importantly, or no, as importantly, sorry, they then mandated that the data be open for going forward from the San Francisco Police Department. Because I think you can make these wins, but until you need to monitor and watch progress to make sure that the immediate wins are being implemented in the long term. So it's just one example of sort of pulling both the state stuff and the federal stuff with the right agenda and storytelling to make a difference.
Yeah, I think the nugget that I'm pulling is the importance of people and all of that. Really, because data's great. Yeah, like data's great, but it's the people that actually turn it into the power that it can be, and not by yourself, right? Like join communities, be a part of ecosystems, be a part of networks, because diversity of thought is just as important as diversity in the data and anything else. And so you want to, I talk to everybody and anybody, even though I'm an extreme introvert. Like talking is how you learn, is how you grow, and how you figure out what are the real things that need to happen and in what ways, because implementation matters just as much as what's written on a piece of paper. Dr. McIver.
Okay, well, good morning, everyone. As noted, my name is Dr. LaShawn McIver, and I am 2 months in, so I as I thought I was. I'm a little over 2 months in my new role at America's Health Insurance Plans, or AHIP. And I'm immediately coming from CMS, and I started at the end of 2020. And one of my first big assignments in this role was to help CMS stand up its health equity infrastructure. So as I heard the comments today from Ms. Chen about some of the progress that's been made, I'll start by saying this is actually a very historic time in healthcare. And I want us to just pause and not sort of rush past what is actually happening, because for some of us, we've been doing this work for a very long time. But this is the first time we are actually moving systems forward. Yeah. And that is historic, because inequities are often built into systems through policy. And so I'm coming from, as I said, CMS into AHIP. AHIP is an association that represents the health insurance industry, and we're often known for our policy. And so one of the things that I have been starting to socialize within our organization is policy is one of the most, policy has gotten us to where we are today from a system perspective. That is why the policy we're developing today is historic, because it's what can help get us out of these system barriers that are impacting the health of medically underserved populations. So, the comments from this morning about the progress that we're making in the data space is historic, because at the start of the Biden administration, and other administrations have tried to move this needle along, and they actually didn't get as far as where we have gotten now. And I can say that because, I was helping to push that rock up when I was in CMS in that role. And so as the director of the Office of Minority Health, we had to ask the agency, right, one of the largest insurers of health insurance in the United States, to say, how are we thinking about the data that we collect as an agency and that we utilize to make decisions? And to that point, we had not actually worked together as an agency to think strategically about data collection and how we use the data that we have. And so it's exciting to hear the progress that's being made and, some of the things that were mentioned here. Now, we were asked last night to go online and play with this tool. This actually was very impressive, and I want to just commend you all for this work because one of the things that I hear consistently across the country is we don't have enough data to make an impact. We need to collect more data, and that is true. The other side of that coin is organizations will say we have enough data to act. And I think this beautifully represents, with the data that we have, we actually can do systemic changes and things. And so this was wonderful to see how you can utilize this tool. One of the things I'll note is the Office of Minority Health at CMS has a Medicare mapping disparities tool, which is not as awesome as this. This is like really high tech and amazing. But I think if you can somehow put the two together, when you talk about the intersection of data, what more can we do and we see? The other thing that I'll note is you had talked, there was a section there that talked about policy and how policymakers can use that data. And again, when I talk about this being historic in what we're doing as a healthcare system, something that gives ideas to policymakers and sort of helps to make this data more tangible is very, very important. I had to work across the federal government, not just CMS, because many agencies came to our office for technical support. And one of the first questions they often asked was, I don't see how my area can do this. Like, I don't see our role in this work per se. I know we have to do it, but I'm not sure how X would contribute to this. And it was because on one part, they didn't understand the data. Data tells the story of why this is important. We have to address this in housing. We have to address this in the workforce, the environment. And so having tools that help build data and show data in a way that brings it to different sectors, right? Multiple sectors. This is how we will continue to advance health equity across the healthcare system. So I look forward to sharing with you some of the work that's underway and certainly responding to that. But I think one of the biggest things that stuck out to me is we may not have all the data that we need in this moment, but when we think strategically and use the data that we have, we can make substantial changes in the healthcare system. Thank you.
Thank you, Dr. McIver. I also want to call out, when we talk about system change, that even having a chief health equity officer in an organization is pretty groundbreaking. I don't know that that's a role that anybody would have even thought of 5 years ago. So your work is reflective of the fact that this role is even acknowledged, that it needs to be in place to make sure that this work continues to move forward. Second question. Man. Based on your background, sectoral experience, and current work with data, where are the biggest opportunities to apply data to address dimensions of racial equity? To tee something up a little bit, let's start with Ms. Pettit.
Sure. I think, and I think that April acknowledged this too with the equity assessments for policy, that racial equity does not happen naturally. It really needs to be baked in from the beginning. Mm-hmm. So it doesn't happen after the fact, either. So I think putting it first is a big change, and not just looking at it afterwards. I think that you have to work on two fronts: improve the data, and I do love, rolling down in data, and but also support the people using the data. So and work on those in parallel. And I think on the, just to play off your answer, I think one of the pieces we're really trying to wrestle with is there's I think we are used to seeing racial disparities, and many of my local partners talk about the same map, right? The same map of disadvantage. You can do environmental justice, housing, education, and and you don't need to tell these communities that there's disparities either, so you're not informing them about it, but really thinking about how to shift to at least accompany the outcomes data with systems indicators. So for example, you can have disparities in scores by race, and that really talks about like, well, is that blaming the children? Is that blaming the families? How about we talk about, you know, per pupil spending or the quality of the courses, or like back it up so that you can really think about what are the root causes and start to get at the right solutions. So maybe tutoring individuals is good, but also maybe we should look at school funding and think about that too. So I think there's a good report by Strive Together that starts to do this and really do some detailed work around, but it takes some retraining, I will say, as a researcher who, not new, but 27 years at the Urban Institute, that's there. On the supporting people to use data, I mentioned a grant program that Urban does with Microsoft Justice Reform Initiative. So that's a little bit of funding, some technical assistance, 6 months, just a little push for nonprofits to find out actually that they are data people, which I think you said that. We think everyone's a data person.
I think everybody's a data person.
That's fine. That's there. There's also some exciting fun pieces, like, and most of my work is at the community level. So my Milwaukee partner, Data You Can Use, holds a Data Dreams competition. So nonprofits come with their questions, which is always the most important thing to start with, and then do sort of a pitch session at their Data Day, which happens next week. And then they receive $10,000 in technical assistance to help answer their questions. So one, it's like surfacing new questions, and even the folks that don't win the prize have made progress in thinking about how data can help them. But there's a really great example from the federal. I know there's a lot of federal folks in the remote audience, are the HHS Office of Minority Health. I know there's different offices around the country. It's supporting my San Antonio partner, CI Now, to be combining the social determinants of health, which I think was mentioned in Temi's work, with the health outcomes. So and this is pulling together the health information exchange, the public health department, the community folks. It's really, you know, a baseline for folks to work together to see how those factors affect the actual health outcomes, which includes a great online platform I recommend you looking at with public data, but also the training, the technical assistance, the outreach, the convening to wrap it up. And that is an example. There's the other grantee is in California, I think working on Asian indicators, but it's an example of the federal government supporting this, both to help San Antonio, great work is happening, but also as a model, like you said, for others about what can really happen locally. So those are my initial ideas.
Yeah.
I will pause and go to the next person.
Who's looking at that?
She was looking.
Oh, I was looking. Right to left.
So just reframing where we are with the question about opportunities. And so I think about it, what are the opportunities in the payer space? And I think that's both federal and in the private health insurance space. This is the top, this is, you know, what I said before, like this is new. This is very new. We talked about new roles. Chief Health Equity Officers didn't exist years ago as a layer of leadership across the health insurance system. And so we're 3 years into introducing what equity is, what do we mean by this work? And in addition, 5 years ago, I was in meetings, and when I said the social determinants of health, I often got blank stares. And so fast forward 5 years, you know, into the future, I think there are lessons that we learned from the pandemic that have just turned us turned us into a whole different direction. And so when I think about the opportunities, and especially as we're learning more and more from the data, so actually I'll back up. One of the things that we did when I was in my former role at CMS is we released a framework for health equity. So how CMS as an agency approach health equity. And one of the first priorities in that related to data. And the second one related to assessing disparities. So we talked about the importance of having structured ways to assess health disparities and health inequities. And I always would say that was my favorite priority because we're starting to ask the actual questions. And so that's what's happening in the payer space. And that's both federal and private. So we've had a few years of starting to think about, okay, how are we coalescing around definitions, around approaches, how are we being measured, how are we being paid? I think most of that is moving along. But where we are is that we're still learning. And so the data sources that we talked about today and the things that are continuing to emerge and become refined are important tools to shaping the future of healthcare because they're telling us where to direct our resources and our interventions to impact those that are served. And so in the private health insurance space, I've had the honor and the pleasure of talking to my counterparts across our membership. And so when I was at CMS, we covered 150 million lives. Our association's members cover 200 million Americans. So this is a really unique opportunity to build a bridge of equity across the entire healthcare system in this role, which was not here. I'm the first person in this role. And so when I think about the opportunities and I think about the data, resources, and tools that we have, it's really going to be instrumental in helping us form and shape how we move forward as a collective. And I say as a collective because as I've talked to my counterparts across the country, some health insurance payers are very far along. And there's others that are, they're really just starting to build the foundation of how they do this work in the future. One of the common denominators, though, is, and predictor of their success is how well they understand, collect, utilize, and truly use their data to develop interventions. And so I guess that would be my response to that question is I think the greatest opportunity right now is we have such refined data resources that can be instrumental in helping payers think through benefit design, think through how they engage with communities, to ask the questions, and the data helping to guide where they go once they get that information. That's the greatest opportunity is we have the opportunity because with certainty I can tell you just a few years ago, this was not widely understood across the healthcare system. So I'm really excited for where we're going in this space.
Yeah. Dr. Pritchett.
So I'm gonna also maybe take a slightly different turn on this question and thinking about the opportunities that exist on how we're funding research and who's getting the dollars that are supporting dismantling or addressing any health disparities that exist. And so we have a number of different open data sources that tell us where funding is going through the federal government, right? So USA Spending is one route that you can go to understand where contract dollars are going. There's also resources like the Unite initiative dashboard that NIH hosts that talks about where is our funding going to support biomedical research. But what that also helps us to understand is who's not getting the funding. And the opportunity for that I see is to understand, well, why not? How do we use this information to design interventions to help prepare people to apply for funding opportunities? How do we help strengthen collaborations and partnerships amongst different entities, academic institutions, healthcare institutions, so that people are well prepared to go after the funding that is out there? Because there's a lot of dollars that leave the door, not just through this organization, but across the federal government to really help support different environmental, healthcare issues, but a lot of people don't know how to access them. And so for us, one of the big opportunities is one, putting the information out there, being very transparent and holding ourselves accountable, saying, hey, this is where our research dollars went to. And you can also infer where it didn't go to. And so that tells our internal staff, what type of interventions we need to be focusing on. Beyond just our external reach, in addition to Executive Order 13985 and 14091, there's also the, complementary one, 14035, which focuses on the internal workforce. So it's very hard to think about addressing outside activities when inside the house may not be as racially dispersed as it should. And so we really are using this as a collective to address not only external, how we're funding people, but also looking at our workforce demographics to understand where are there disparities and who's climbing up the ladder. And yes, disaggregated data is powerful, but also intersectional data is equally as powerful. When you think about, who's climbing up the ladder, if we're looking at just women, we might see one number. But if we look at Black women that are in senior leadership positions, that might tell a whole different story and then really tell us that we need to be exploring things like our retention data, our exit survey data, who has access to training, who has access to sponsorship and mentorship. And so for me, I think the opportunity is leveraging both internal demographics, external funding information, and using that to collectively move the needle in both domains. So that's where I see the biggest opportunity.
I just wanted to add to that. Something that you said just kind of sparked the notion of the whole government approach. Mm-hmm. And this is what it looks like in action when we talk about systems of change. And, through the executive orders that have come out through the Biden administration, it has really pushed the entire government to think differently about how it operates. And so our data is only as good as what information we're putting in to get out the data. Right. And the work that NIH has done over the last couple of years to be more intentional on how they're approaching the researchers that are conducting the research that's putting out the data that we're leveraging has been very impressive. And I just want to commend NIH for the work that they're doing in that space. And that is a part of this whole government approach to advance equity across government benefits and services. So just wanted to call out those efforts.
There's a data lifecycle model. I'm sure everybody in here has heard around data, transformed to information, transformed to knowledge, transformed to action. It's traditionally taught, and it's how you mature data to make it that resource that's useful. And I think over the decades and over time, we've seen data and been able to transform it into the information, transform it into the knowledge necessary for us to begin to understand the power of data and what it can do and the stories it can tell. We're at this point right now where we need to get to that action. And technology alone can't solve that. There's a glue. There's a glue necessary between knowledge and action that energy needs to be put towards. Like, how do we tie people and technology together in a way that meaningful, scalable action can actually happen? That's what I hear threaded through everything that folks that you're saying and conversations that I've had. We haven't said the word AI in like an hour, and I'm very proud of us, but I'm gonna just throw it out there and just push it to the side. But there's like this moment that we're recognizing right now where we have the skills to create the tools. We have the data to inform the work that we want to do. But there's this little leap we need to do in order to make it actionable. And some work needs to be put into that space to really change us from this culture of getting the knowledge, seeing the tools, to turning it into actions going forward. So just want to put that out there because that's what was coming up for me as we're having this conversation. Thank you. We're going to turn to individual questions, and then I will release everybody on you guys. So we'll start with Dr. Pritchett. You're in your new role as Chief Scientific Diversity Officer within the National Institutes of Health at the National Center for Advancing Translational Sciences. Say that 10 times.
Yes. Or just say NCATS.
NCATS.
There you go.
I knew you when you were at NIST.
Yes.
And serving as the not Chief Diversity Officer, the Acting Director
Yes.
for Diversity, Equity, Inclusion, and Accessibility at NIST. And so I remember the work and all the things that were happening there. And given your new role and this shift from being in the NIST world to now you're in the NIH world, can you tell us a little bit about what it looks like to embed equity in the work that you've done in either role?
So, the shift is still new because it's literally still happening. I'm still definitely, having conversations with NIST colleagues and into my new NIH colleagues. But, embedding equity really starts from just the passion and the desire that was there well before the executive orders were released. Specifically thinking at NIST, because again, 3 days in, at NIST, we really took a data-driven approach to think about equity across various domains. Particularly, we had a group called the Steering Group for Equity and Career Advancement, where we were looking at women and people of color and their ability to rise up the ladder, right? And so we, through that particular working group, we actually funded 3 different studies, one which was external, led by Coach, and then 2 that were internally led, to really understand both qualitatively and quantitatively what disparities existed. And that of course required resources. So embedding equity requires embedding resources to do the work. And so I was really grateful both at NIST and now at NIH to see those resource dollars being baked in, and this becoming a part of just everyday conversation, not making equity the add-on at the end or the garnish is sprinkled on at the very end, but really baking into everything that we're doing. So asking our questions like, who's not in the room? How are we not addressing, or who are we not addressing with whatever policy we're putting into place? Back at NIST and through the Department of Commerce, we of course had the Racial Equity Action Plan that came out in response to 13985. The DOC DEIA strategic plan, and then NIST had its own strategic plan. And so in all of those, we leveraged data, of course, using the equity assessment that was released through OMB, but then also doing self-assessments and putting forth very robust, strong plans that we can execute against. Plans are great, but it means nothing if we're not really ready to implement them. And so we also stood up an equity council at the DOC level, which was chaired by Natalie initially, or really spearheaded by Natalie. But then we also stood up implementation teams and made this the work of not just myself or my office, but every single person. So embedding equity really looks like embedding it into the role, everybody's role. We created performance elements that could be added to people's performance plans so that this wasn't thought as an add-on, but really something that they integrated into their work. So the idea of embedding it means that it has to be a way of thinking versus a thing, this mythical thing that we're going after versus how we approach every single program, policy, activity that we're doing.
So it's a culture change.
It's a culture change. And that, it really is from top down, bottom up. It has to be a mind shift on how we're approaching it, because when we think of it as this thing that we add at the end, that's what makes it not sustainable.
Right.
That's what makes it easily wiped away with another executive order, which was tried in previous administrations, but
That never happened. Never ever
But
happened.
yeah, so it's embedded just through how we approach the work.
Thank you. Dr. McIver.
I'm getting to your question. Dr. McIver, you have a long and illustrious career advancing health equity in the public sector. Can you share more about how you've seen data evolve in the past decade and where you believe it can be best leveraged moving forward to achieve health equity?
Thank you. I like that illustrious addition. That's
You
wonderful.
need to add that to your resume.
As I said, I'm very excited about where we are today because we've actually been talking about this in different parts of healthcare for a very long time. And I think I'll talk a little bit about my role and how I'm seeing where we are now. So what I'm excited about in terms of data based on my experience over the years is, one, more people are talking about it across different sectors. And that's important because in order to address health inequities and to eliminate health disparities, we need to work across sectors to do that. And so we're pulling in data from different sectors and utilizing them in a much more impactful way today. I'm a recent member of AHIP's leadership team. And there's 3 fundamental things that I'll be working to do within the organization over the next 3 years. The first is to build our infrastructure for health equity. I don't look like a construction worker, but apparently that is a part of my job description, and that I construct and build and help to create these systems, because without that, health equity is not sustainable. You have to really understand how it fits into your enterprise, how it is everyone's responsibility to do this work. over the time that I spent at CMS doing this work, that was a part of what I did, is to help build our infrastructure of health equity and take equity from this unattainable, huge thing. I don't know where to start. I don't see a role for me in this in particular. It's in that program. It's not in my program. We had 26 offices and centers, and we all had a responsibility to think about how our work impacts those that we serve. And that includes people who live in medically underserved communities and or are negatively impacted by our current healthcare system. And so that's systemic work. That's changing culture. That's embedding it in your performance evaluations, right? That is thinking about your strategy and how you think about equity at the beginning and not putting it at a period at the end. And I think that's what's happening across the healthcare system. So in this new role, my first pillar of work is bringing our organization to another level of this. We've been doing it for about 3 years, some of this work, and we actually had some robust work that we've done in data and working with our plans to think through some of their data strategies. But that pillar of work, we're really focused on how do we, as an organization, show up in this space as a leading policy voice. How do we become a stronger agent of change as we're helping to shape healthcare policy? The second pillar, I mentioned we're a member-driven organization. So members are doing this work across the country. We have health plans that are in this room that are represented by our organization, meaning we are on some of these health plans. You would want to know how they're thinking about it and how they're sort of strategically approaching that. And so working to help meet the needs of our members who are doing this work and trying to bring as many people along as we can to provide the support and resources and tools for their critical thinking in this space. And so that's from their leadership to those who are implementing this day-to-day in their day-to-day work. And then the third pillar is developing an industry strategy that represents a commitment that the entire health insurance industry will stand behind to advance health equity as a collective. That's going to be very powerful. When I saw that transformation happen within CMS, it was one of the most powerful things I had seen in health policy in a very long time. And I often would say, we're like a huge ship. And if we just could turn 2 degrees in a different direction, we can exponentially make changes in the healthcare system. And so part of this work will be focusing on what is that 2-degree shift we need to make in the private health insurance market to help impact health inequities or eliminate health inequities and health disparities. And so that is a part of the third body of work that I'll be focused on. And so the thread throughout all of that is data, different types of data that will be helping in shaping and driving that. But again, really exciting work ahead. And I invite you all, please reach out to me as we're thinking and building the strategy. We hope to release something in the coming year that will be more public about some of the concrete steps that we're taking. But I always end my conversations by saying, this is the beginning of the conversation and not the end. So please reach out to me as you are doing this work, and certainly as I'm helping to build this work in the health insurance market.
Thank you so much. And I agree. Let this be the beginning of a conversation. So we will go to Kathy, and Kathy has slides.
Oh,
So-
no.
No slides anymore?
I didn't want to be the only one with slides.
Okay. Kathy doesn't have slides. You mentioned
Visualize.
you mentioned some of the work that Urban Institute is doing on how different types of data reveal important racial equity issues. Can you tell us a bit more about bringing different data sets together to understand issues such as climate and health or health and housing? And where do you see the research moving in the next several years?
Thanks. I'll start with some good examples. I think my network really requires that our partners collect data across crime, health, education, housing, because that's how neighborhoods and our personal lives, our families work. So it's hard to separate one from the other in all those interactions. So it's really like part of our network's DNA. And I brought in an example from with publicly available data and then with more advanced data to try to illustrate this. I think COVID was a real moment where we saw, why it's important to like have the data at the ready. So data development takes a long time. It takes a lot of investment. New products take a long time. And when that, you know, within 2 weeks when everything shut down and governments were thrown into disarray about what to do, and private sector agencies, nonprofits, our partner in Philadelphia, I was glad to see Philadelphia highlighted there, is the Urban Health Collaborative at Drexel University. And they're really one of the stars of pulling different, understanding how all of those sectors intersect together. And I think that the process matters as much as the actual numbers and data. So they have experience really co-designing boards and asking people what information they need. And as COVID was beginning and they were getting a lot of questions about folks having to make decisions really very quickly about how to respond, they began a local dashboard that included many of the elements of the Social Vulnerability Index, housing, employment, income that we saw, along with the places data, which I recommend that you take a look at. It's health outcome data for at the track level for the country. So pulling the health data in with the context data and some other data like from Evictions Lab and other pieces that were going on, and adding also in some access to resources into their dashboard that they help co-design with their stakeholders. So this really gave everyone sort of a go-to place and a common understanding, and really helped people break down silos and think beyond what their little piece was. And so the elementary school looked at this to help design its support student services for their kids that were remotely learning. The public health department looked at it for disrupted social services. They developed a spinoff with the local LISC, a community development organization, to look at where they were going to lose affordable housing and have these health risks at the same time from the health outcome data that was showed where people were vulnerable to COVID. So it really had people shift from like, what services am I providing in this narrow lane, to how are we thinking about the families we're serving, and what are their lives like, and what are the multiple barriers and threats they're facing as we work through this crisis together. And all of that is very easily accessible at data. Of course, it takes time to design it well and tell the story, but data access is not the problem there. The other example is from my Cleveland partner, the Center for Poverty and Community Development. And they worked with their homeless services agency at the county level at Cuyahoga County. And they have one of the most advanced integrated data systems for the county. So I forget, 2,000 agencies integrated the data at the individual level and with full privacy protection to do really analysis. And they were working with young adults experiencing homelessness, and how the systems were supporting and helping them. So they merged the homeless management information system data on homeless services with the workforce program data. And perhaps not surprising, there's very little overlap. So basically, there were very few young adults were able to access the workforce programs that the county had been funding. And of the people who were accessing it, most of them were men, even though 80% of the young homeless adults are women. So it both showed, again, this age, gender gap that was there, that they didn't realize existed, and they were not reaching the goals and missions that they had together. But As a result, with this evidence, though, they were able to your point, access, have the data to make the case and access federal funds to do a pilot that really did more targeted outreach and supportive services that were directed particularly at young adults and at women to start to fill this gap. And then they will be able to continue monitoring to see, did this pilot make the impact and improve things that they wanted to. So I think that data took a long time to develop. So it's both, don't be intimidated, start small, but think big. But also think big and think about data sharing and this beautiful advanced system and agencies working together. And so you have to hold both those things in your head at once.
Thank you so much. So I will say moderating 101 is you're supposed to pay attention to the time.
Oh, yeah.
I failed. I failed miserably. And so we have one closing question, but because we've got 5 more minutes left in the panel, I'm going to not do the closing question, and I'm going to give the floor back to Dan so that he can moderate questions.
Sorry.
Phenomenal set of insights from all of you. Thank you so much. And I know we have one question, at least a couple online, so we're going to first go online and then in the room. So I know we have a question from a government colleague. Ruth, can you read the question?
Jeanita Johnson from HUD asks, when do we have an intersection of having all the data you need to the willingness to change external and internal behaviors?
Ooh.
A simple one.
Easy. The answer is 3.
I'll give. Is it when, or where, or how many?
So I'll relay the question back, and then I'll give my thoughts, and then So what I heard was we've got data, we've got tools. When does it actually change culture and things that happen in an organization? And I think Dr. Pritchett and everybody kind of touched on that a little bit. And it gets back to that glue between knowledge and action, right? Sometimes we look at data and making it an actionable resource as a technology problem, but it's actually not. It's an ecosystem problem. It is the ability of people to take what they've learned from the data and drive change. Just like all the conversation around AI and the worry that, AI is going to take over the world and I don't know, us people are going to become the pets. I don't know. It's people that drive the change. It's people that influence what happens with technology and with data. So if you want to see change happen, then it's people that make the decisions around those cultural change. So there's a will of the people that have to happen, just like what Dr. Pritchett did in NIST, to be able to drive and embed equity in those things necessary for data to be a powerful, positive resource versus the unintended consequences that can sometimes happen with people.
And I'll just offer some perspective. When I heard that question, my first response was, there is change on a micro level and to some degree. Like when you hear examples like this, that sounds like change to me, right? Like there are communities that are changing, there are people that are changing. It's the macro level change that we're looking to see, right? Like we know we spend the most as a country on healthcare, but of high income countries, we still are at the bottom of the list. We should actually be very disturbed that we're still at the bottom of this list, spending this money. So that's the macro change that we have not seen, where is the dollars going to actually make sense in healthcare for people who are impacted by our healthcare system. So, I think I love this starting small, but thinking big. Yeah. We're seeing changes in individuals, in communities, and in some systems. What we're really working towards is how do we see this macro level change? And I think this is a part of what is the beginning of what's going to help drive that micro level change. But we still have a lot of work to go because people, right? Like people make all the difference. So I would just offer that.
Thank you.
Is there a question in the room? Question or comment? Yep.
Yeah, congratulations to everyone. My name is Julio Guiti. I do a lot of work around climate change agenda, but I had a question about differential privacy. How do you feel that differential privacy is going to impact the work that you are doing? And if you can share some of the best examples throughout the country on how data for racial equity have become a racial equity budgeting at the municipal level. Thank you.
I'm gonna defer to Kathy on
Yeah,
that one.
well, I just wanted to, Scientific Advisory Committee, as they were implementing differential privacy, and we have statistical experts at Urban that can talk to you about the method question. I think the most important thing is the hundreds of thousands of users of the American Community Survey and HMDA and LED need to understand, like, what's the fitness of use of this data now? And so we're not going to have an alternative to ACS. This is the data we will use. We need to use lit track level data. How do we make those decisions to decide if this data is good enough for what we need for our question that's there? And I think the Census Bureau has some ways to go to on the interpretation side for everyday people, and even including myself, because differential privacy is very fancy. That's there. So I think I can refer you to my colleagues and connect you about the debates on the methods. But I do think on the practical level, that's the data we have. But we will need to relearn how to use it. And we went through this before when we moved from the decennial census to the American Community Survey. So I lived through the same sort of learning process, and we can do it again with differential privacy.
The second part?
The second part spoke to local government, right?
Yes.
It was how
has it been how has it been embedded in budgets?
I have a wonderful example for you. So I just returned a few weeks ago from San Antonio, and they had their second annual health symposium for the city.
A second San Antonio example.
Oh, yes. Oh, yes. And it was a wonderful, there's a lot that you're hearing about how states are thinking about equity. In some states, people can't even say it in their state, and they're working on, they're doing this work and they can't talk about it within their local government or state government. And so the example I had was, they talked about their strategy, and a part of it is what you spoke about earlier, is they really work to embed it in how San Antonio approaches health equity, from their workforce to the programs across the city. And so that's a wonderful example, because it's in a state that there have been challenges in addressing equity, but at the local level, when this is not a small city, right? So at the local level, right? At the local level, we're seeing that their local government entities are really working to advance equity. So I just wanted to at least highlight that.
Thank you for that.
Interesting. Well, we are at time. Joel, you want to join me in thanking our reception once again? Program from sort of the shaping, framing remarks, April, thank you for those. The introduction of a great tool set that will, I think, help move the community forward in different ways, and the insights from the panel. Just a terrific morning. Thanks to all of you around the country who have joined us online, and thanks to all of you who made it in person. And it was really just terrific. And Joel, I'll let you have the last word.
Last word is just to add to Dan's thanks, and to quote you, Dr. McIver, we really hope this is the beginning of the conversation. We will be in touch with you all, probably more than you want, because we really do want to follow up. We really welcome input, collaboration, anything we can do to work together to advance this important work. And again, thank you, April, and thanks to this amazing panel for everything you contributed today.
Thank you all for coming.